Clonazepam is one of the strongest anti-anxiety medications available. It's used for anxiety, seizures, panic disorder, restless leg syndrome, sleep terrors, sleepwalking, Tourette syndrome, and rapid eye movement behavioral sleep disorder. It's one of the strongest benzodiazepine type medications available. It increases the firing of the neurons by calming the GABA, by acting on the GABA receptor system. So it's available in a wafer form and a disintegrating tablet. So those options could be good for people who have trouble swallowing pills. Again, it's one of the strongest available medications. About half a milligram clonazepam is equivalent to 1 milligram of Xanax, or about a 0.3 milligrams of clonazepam is equivalent to 1 milligram of Ativan. Its dosing is typically in 0.25, 0.5, 1 or 2 milligram increments. I usually see this medication dosed once or twice a day, but there are some people who are on it up to 3 times a day. Clonazepam is particularly unique in that it's not only strong, but it works longer than many of the other medications in its class. So it's a safer option to help with getting off these medications for a taper, as it's less likely to cause significant withdrawal symptoms. Speaking of benzodiazepine withdrawal symptoms, here's an image that describes some of the common symptoms associated with it. Also, what's unique about clonazepam as far as anti-anxiety effects is that it can be more helpful for physical symptoms of anxiety, such as heart palpitations, shaking, tremors, maybe stomach issues. Although this medication sounds great and can help with so many conditions, it needs to be taken cautiously for several reasons. The body can get dependence on it, both physically and psychologically, so it typically should not be taken longer than a 6 months time span. If someone has been on this medication for a good amount of time and taking it regularly and is planning to get off of it, it needs to be decreased gradually, otherwise there's a risk of seizures, and unfortunately seizures are one of those conditions which can cause someone to die suddenly. Other major concerns of clonazepam is that it can slow down one's breathing. So the dose one should take cannot be too high, especially in people who are obese or have limited ability to expand their lungs. Opioid pain medications and alcohol can also restrict the breathing in a similar fashion, and so this medication should be used cautiously in conjunction with those medications or alcohol in particular, because it can stop the breathing and some people actually overdose from it. If this medication is lost or stolen, the police should be notified and a police report should be filed. This medication can be abused, especially with those who have a history of addiction. Those are just some of the warnings and concerns. Some people are able to live a normal life with this medication, so it can be useful. For example, in cases of anxiety, it can be helpful with people with anxiety that need something to work quickly or a short amount of time, such as for a few weeks or months. In cases of panic disorder, people can get such strong feelings of panic that they are afraid to go out in public. With this medication, they're able to go out to public. In cases of sleep, this can be helpful as it's sedating, but should not be used long term, as it can affect the sleep architecture and affect one's ability to get normal sleep. Although there may be some exceptions with this in the case of sleepwalking or sleep terrors or restless leg syndrome, but it may be important to first have that diagnosis through a sleep study and get these diagnosed by sleep specialists. In cases of seizures, it can help stop a seizure suddenly, but seizure conditions should be diagnosed and treated by a neurologist, which often will need a referral through a primary care doctor. So we talked about some of the benefits and risks of clonazepam. Some other things to note: it's not really recommended to be used in cases of which people are confused due to a medical condition, not really good to use in people who are anxious or have trouble sleeping due to dementia. This can cause them to get agitated or have mood swings, and also should be used cautiously in people with poor coping skills, like those who suffer from intellectual limitations. And because in a way this works similar to alcohol and sort of like the alcohol effects, where one, if it has too many drinks, they may be impulsive or do some things they regret. Same thing with having too much clonazepam. You can see clonazepam can be helpful for several conditions, but there are several side effects to it. I just mentioned some of them. It's important to weigh the benefits and the risks of the medication to make sure you're doing the best decision when taking it for both you and your loved ones.